I wanted to jump in really quick and ask kind of a high level question. We spent a lot of time in the weeds here on these different papers, and sometimes, myself included, people will look at healthcare cost growth issues, sort of like that old cartoon reference where you've got a hose that's leaking water and you plug one hole, and a new hole opens up and water comes out of that one. With that in mind, looking at this particular paper and then the other third paper that you've already published on capping health hospital pricing, what are some of the potential negative ramifications of neutralizing pricing at different locations or capping prices with hospitals? Will the cost get shifted to other healthcare providers down to the actual healthcare customer? Like, what happens here? Is it actually able to drive cost growth down, or is it going to end up springing water somewhere else in the hose?
So, I mean, there are a number of ways I would answer that. The first is that um, because we're on a Concord Coalition podcast, we like to start from the premise that we need to have some savings in healthcare, that things can't go on the way they are. We're spending too much money per person. The costs are growing faster than inflation and faster than wages. So something needs to be done. So once we start from the premise that something needs to be done, the question is finding the things that should be done that have kind of that make the most sense and impact those who can least afford it the least. I mean, I think that's the other premise that we start from. And so why I like talking about this site neutral payment reform is that this is something that is a Medicare payment policy that's existed for a long time. So Congress can change this and then they can save money for Medicare, which is great. But the other thing is that Medicare really drives a lot of what happens in healthcare. And by changing how Medicare pays for something, we can influence change in the overall healthcare system. So this option saves about $150 billion for Medicare. But then if private insurance companies start also moving to site neutral payments, you can save some money in the commercial market. But even more than that, what's happened is that because hospitals get an advantage by buying up physicians' offices, that's been creating consolidation in all of the healthcare markets. So when hospitals and providers are owned by less and less owners, they're able to raise prices for all of us across the board that have commercial insurance. So we think that by Medicare making this kind of small change, if that then convinces the private sector to also make that change, that can actually lessen the incentives for consolidation and wind up with lower healthcare prices and healthcare premiums for all of us. And I think that's the goal, is to change a perverse incentive, an incentive that isn't really helping patients. But it can help patients because you can ultimately make health insurance cheaper and lower the trajectory of federal spending on healthcare, which is really our goal.
Well, you mentioned prices, and that's leads me to your last paper, which is just simply capping prices. Hospitals, well, you can go ahead and explain it, but I mean, hospitals get paid more from the private sector, much more than they do from Medicare. The question being why the differential, and how would you actually go about capping prices?
Well, I think the first thing is that we understand that Medicare sets prices administratively. This is something the government just says, this is how much a hospital will get paid for X, Y, and Z. And then the hospital basically has to take Medicare, so they have to take that price that Medicare sets. The commercial market is different. We have a lot of different private insurers, and they negotiate with hospitals for the price of basically all of the services that we get when we're there. But hospitals are kind of trusted community members. There aren't many of them in some areas. In other areas, there's a lot of competition. Hospitals, we also as patients have not a ton of information about which hospitals are good, which hospitals are bad. We know even less about what things cost at one hospital over the other. So sometimes we substitute ideas for how good a hospital is with, are we familiar with the brand name? Is it affiliated with a famous university in the area? And those things are kind of stand-ins for quality. So then when an insurance company goes to a hospital to try and negotiate these prices, the hospital is able to demand almost whatever they want because the insurance company doesn't have the luxury of saying, well, we don't want to send you to the George Washington University Hospital. We're not going to have that on your insurance plan. And all of a sudden, everyone who buys that insurance gets very upset because they can no longer go to Georgetown University or George Washington University to have their medical services. So this allows hospitals to get higher prices. And we found that on average, hospitals charge almost twice as much as Medicare, a little bit higher than twice as much as Medicare. But even kind of worse than that is that there are a lot of hospitals that can charge 300 to 400 times what Medicare charges. And this is another one of those things that we all have to pay higher health insurance premiums because hospitals are able to have such high prices. And so we do need to do something about it. Now, what we look at in our brief is what happens if we just cap prices at 200% of Medicare. And we don't really say that because we think that is just a very simple one-line thing that's going to pass in a piece of legislation. What we really want Congress to do is to start thinking about this pool of money that's out there. That is because we have a market failure in hospital pricing. They need to do something about that market failure. And this shows us kind of how much money is out there, almost $1 trillion for higher commercial prices by allowing prices to go higher than 200% of Medicare. So something should be done here. I'm not exactly sure what the right way to do it is, but clearly we need to do something to start impeding this unfettered market power that allows such high prices.